Hi, I'm Marshall Murdoch, a plastic surgeon from the Wits Donald Gordon Medical Center in Johannesburg, and today we're talking about the differences between botulinum toxin and dermal fillers in the treatment of facial wrinkles. People often want to know, what's the difference between a dermal filler and a toxin? Well, a dermal filler is meant to increase the volume of a tissue, and a toxin is meant to relax muscles. So I have a model here to show the effect of toxin on the facial muscles. So if you just frown for me, Julie. So you can see the wrinkles that would occur, angry frown. The wrinkles that would occur, the vertical lines, the sort of rugby post, the angry 11s, these come from an overactivity of the muscles in frowning. And if you lift your eyebrows, the transverse lines that go across the forehead, these are from the contraction of the frontalis muscle. And if you give a big smile, the contraction of the bicularis muscle causes the crow's feet. And when these muscles are hyperactive, they crease the skin as crease your pants. And if you inject a dermal filler, it increases the volume underneath these wrinkles and may help to efface them a little bit. But primarily the effect of a toxin is to paralyze the muscle and prevent further muscle activity. Patients want to know if botulinum toxin is poisonous or not. Well, it is and it isn't. Botulinum toxin is nature's most potent neurotoxin, but the doses in which we use it are very small. There is a concept known as the therapeutic index. This is a number which is given to the ratio between the usual therapeutic dose and the dose which causes toxic side effects. The higher this number is, the safer the medication. Common drugs such as paracetamol, aspirin, even alcohol and pure water in enough dose have toxic side effects. The real question is, what is the therapeutic index of botulinum toxin versus other commonly consumed medications? Paracetamol, for instance, has a therapeutic index of 8:1. This means that if you take 8 times the recommended dose, you may experience toxic side effects. Aspirin is 6:1, alcohol is 10:1, and botulinum toxin is 80:1. This means that botulinum toxin is 10 times safer than paracetamol, and 12 times safer than aspirin, and 8 times safer than alcohol in the recommended dosages. Patients want to know how botulinum toxin works on a molecular level. Well, it gets absorbed into the nerve ending, which is what speaks to the muscle, and the actual toxin itself is really an enzyme, and it gets into the terminal nerve ending and essentially degrades a small portion of the docking protein so that the nerve cannot release the neurotransmitter which activates the muscle. It does not in any way harm the nerve cell, and the nerve will simply make more of this protein. The protein will be shipped to the end of the nerve, and it will be reinserted into the nerve ending, and the muscle will start working again. This is why the muscles always return to their normal functioning after about 3 to 4 months. Okay. Once botulinum toxin is injected into the patient, there will be a couple of days before the effect is noticed by the patient. An interesting study showed that 50% of patients may experience a result within 1 day, but on average it takes between 5 and 7 days for patients to experience their result. And it takes up to 2 weeks before the full effect is obvious. How long botulinum toxin lasts once it's injected and working and the muscles are relaxed? Well, once the muscles are relaxed, the docking protein on the nerve has essentially been enzymatically changed, and the nerve will have to make more. The actual toxin doesn't last for more than a few days within the nerve cell, but it takes several months for enough of that protein to be made by the nerve cell and reinserted into the nerve ending. Patients can expect between 3 and 5 months of duration from their botulinum toxin injections, with an average of 4 months before needing re-injection. It's better to be injected before complete recovery of the muscle. Patients want to know if there are side effects or risks to obtaining botulinum toxin injections. Well, like all medication, there is always potential side effects and risks. The risk profile of botulinum toxin is really excellent, and the side effects have been shown to be minimal. The most significant side effects occur when toxin is injected into the frown, and inadvertent paralysis of the eyelid muscles occur, and the patients are unable to open their eyes. This is known as a levatoptosis. This is perhaps the most serious side effect of the botulinum toxin, and although it can be treated, it usually takes the 3 or 4 months for it to recover. Patients want to know if botulinum toxin is cost effective in the long term. Well, in terms of aesthetics and what is achievable, in terms of a cost to benefit ratio, I believe personally that botulinum toxin is untouchable in terms of its long-term benefits and cost efficacy to patients. It is certainly much better than surgery for the treatment of fine wrinkles and lines on the forehead, the brows, and around the crow's feet. Patients want to know when is the best time to start using botulinum toxin injections. And really, there are 3 reasons why patients will begin using it. The first is when the patient looks in the mirror and starts to see something they don't like. That is probably the correct time to start with treatment. The second is for social reasons. Many patients find that they project an image or an emotion, such as anger, confusion, disinterest, when they don't intend it. In other words, their feeling and what people perceive they're feeling is discordant. And for social reasons, they may begin treatment. And the final reason is a relatively new and less common reason for starting treatment, and that is something known as prejuvenation. Many patients see how their parents are aging and don't want to age the same way, and they come for treatment to prevent the signs of aging before the signs of aging have become apparent. Patients want to know if there's any downtime to botulinum toxin injections. Well, the answer is there usually is very minimal to no downtime. They are injected with a very small needle, and there's potential for bruising and for small bumps. This usually settles within an hour or so of the injections. This depends on the doctor and the consultation process, but if the patient is a regular and is having a standard treatment with botulinum toxin, it may take as little as 5 minutes to administer the usual treatment dosages. Patients often want to know if botulinum toxin injections should be started at a younger age, and how young is too young to consider treatment. Well, there are many medical indications for botulinum toxin, such as the treatment of cerebral palsy. In patients as young as 5 years old, we may inject dosages significantly more than those used for aesthetic purposes. So from a medical point of view, there is perhaps no age over 5 where it is too young to inject Botox. It really depends on the patient's desires and the patient request. Patients want to know if there are any indications or uses for Botox other than for aesthetics. Well, there are many of these. And one of the primary indications is the use of botulinum toxin for hyperhidrosis or excessive sweating. Particular areas which can be treated include the armpits, the palms of the hands, and the soles of the feet, although many other areas such as the face, the scalp, and the back may also be areas for treatment. The most common uses for botulinum toxin are primarily for aesthetic benefit, although there are many other usages such as the treatment of excessive sweating, as well as for migraines, which is becoming a more regularly used indication. The dosages for migraines are significantly higher than those used for aesthetic treatments. Treatment dosages in the region of between 190 and 250 units may be required for the treatment of migraines. Another interesting indication for botulinum toxin is in the treatment of grinding of the teeth, known medically as bruxism. the botulinum toxin may be injected into the temporalis muscles as well as the masseter muscles to relax these muscles and prevent the patients from excessively grinding their teeth, particularly at night when they're less aware of it. Patients want to know who can inject botulinum toxin. Well, in South Africa, botulinum toxin is a Schedule 4 medication, and as such may only be administered by a medical professional. So it is either a doctor or a dentist who may inject in South Africa. Patients want to know if botulinum toxin is a recent development on the aesthetic market. It has been around in clinical use since the early 80s, which means there is nearly 4 decades of clinical trials and post-market experience with the use of botulinum toxin for both medical and aesthetic benefits.